So hi, hello everybody. I'm representing the National Center for Disease Control. That is also the principal recipient for the Global Fund National HIV Program. So basically that's where I work. And I will briefly present you the PrEP pilot project that we started in like a couple of months ago, since September 2017. So what I would like to do, is it available to turn the slides on, please? Okay, thank you. So our PrEP pilot project is called, this brand name is PrEP. You can see the logo there. So I decided to split my presentation into 3 different lines. Like, and more talk about the perspective, how did we introduce the PrEP in Georgia and what was the steps that we undertook. I think it will be interesting in perspective from the lower middle income country, like what steps have to be done. First, we started talk about the PrEP project since 2015 when we developed the national AIDS strategy, and the PrEP was included as the basic prevention, part of the basic prevention package. But since then, in 2016 and 2017, we had the negotiations with the Ministry of Health, who unfortunately refused to financially support implementation of PrEP. And then we switched to the Global Fund again. And now the pilot project is implemented with the financial support of the Global Fund. So what we did, and what is really important, I think, for the countries like Georgia, to maximally involve the international communities and international organizations such as WHO, US CDC. What we did, we requested the technical assistance from the Global Fund CRG initiative that provided the technical assistance through the ECOM and APCOM regional and international networks. And what it did for us in first hand, like not only clarified for us what has to be done in country to present PrEP, but also helped us to navigate the negotiations and discussions among the stakeholders, like the Ministry of Health, the community and the AIDS Center, and so on. And then we had the country dialogue. That was a really important process because to, again, navigate and clarify all the misunderstandings between the national stakeholders in order not to have some surprises during the phase of implementation. So the second line of the slide is about the scale, so what we have in place. So it is the 1-year pilot project that is targeting the 100 people. It is targeting the MSM and trans women communities. At the moment, we have around 25 persons involved into PrEP. Majority of them are the gay men aged 20-30. And we do provide it in the capital of Georgia, but do not limit the people in terms of their nativity from the other regions. We do provide the daily PrEP with the follow-up monitoring every 3 months. And do provide the additional support services, like the clinical part of the services is the assessment of the acute HIV symptoms. It is the testing for and treatment free of charge for the STIs, including the syphilis and other bacterial STIs, testing for the hepatitis B and hepatitis C, and also the renal function control. And the social support services like the adherence counseling, risk reduction counseling, and social accompaniment, and etc. So basically that's the pilot we have. Thank you.